First off, Mr. Chairman, just want to thank you for convening this panel of excellent witnesses. Really appreciate the opportunity. Just so I'm correct with this, we all agree that medical inflation is a real thing. That is a fact, and it is undisputed. The increase in healthcare costs from 2000 to 2024, medical care went up 121.3%. Now, so all goods and services went up about 86%. So the average premium cost for that family of four in 2008, correct me if I'm wrong, was $12,608. I believe my numbers are correct. In 2025, that was $27,000. So we clearly have a problem. Now, I understand the concerns on the ACA. I know some of my colleagues and I voted opposite on this last week or so ago. But my hopes that Senate picks up something, makes some changes, brings us something back. Not sure what's going to happen there, but let's just, for the sake of argument, under Obamacare, control cost premiums have doubled since 2014. 35%, this is the number that is staggering, 35% of the enrollees didn't file a single claim last year. Now, that's showing, of course, that coverage does not equal access to care. Some interesting other tidbits that we can talk about, but Mr. White, I do want to just touch on a few things with you, if you'd be so kind. Would you expanding the length of insurance cover periods provided by the insurers to individual encourage plans to support preventative care more, would that?
Absolutely. I think that allowing them to provide premium discounts for outcomes measured and confirmed behaviors for wellness, fitness, MAHA-like activities would be huge.
Okay, so doctor, let me go to you if you don't mind. Can you speak to any of the data that demonstrates how these investments in preventative care for patients, whether that's obtaining acute diagnosis early or treating some of the underlying causes before they spiral out of control, can bring that cost down on the long term?
I think what I would say is that I wouldn't evaluate those interventions just on a cost basis, because you're getting something. You're improving health, you're improving longevity, and so I'd actually suggest you evaluate on both measures.
Say that again.
Even if some of those measures don't literally reduce costs, you're getting something for them. You're improving health, you're improving longevity, and so I would encourage you to think about them on both dimensions.
Okay. Mr. White, I'm going to go back to you. I'm looking for some more facts as my time is running short. So make sure I'm right on this. Health insurance coverage breakdown, correct me if I'm wrong. Employer-sponsored, 164 million individuals. That is 48% employer-sponsored. Medicaid, that's 77 million. That's 22%. Medicare is 63 million. That's 18%. Obamacare, 24 million. That's 7. Veterans, TRICARE, that's 10 million, 3%. Uninsured at 7%. Just thought I should get those numbers out one more time. Mr. White, about 75% of American workers are offered health insurance through their employer. However, that percentage of companies that offer this benefit decreases with the size of the company. And in 38 seconds, can you talk about how policies like association plans can support small businesses offer health insurance as a benefit to their employees?
Yeah, Obamacare massively increased regulations on small businesses. About half of small businesses offered coverage 20 years ago. Today, just a third do because of those regulations, and small businesses got none of the subsidies that the individual market gets. So it was a deliberate policy to get people out of group coverage and into Obamacare, where the costs are 3 times more, and the subsidies that taxpayers pay are 3 times more. So just keeping people in small business would save taxpayers and small business employees money. Association health plans essentially allow those businesses to group together and come under the large group market rules, reducing the regulation. So it makes it cheaper. AHPs, according to CBO, would reduce premiums by 30%. 30%. That is much more than a subsidy could do or even the CSR payment policy. So it is a huge change.
Thank you, Mr. White. I appreciate that, Mr. Chairman. I yield back.